Now, one similarity between yourself and State Representative Hinson is that you both served at the Iowa State House. And I believe it was 3 years ago, there was a vote on tax cuts here in Iowa. You voted against that, if I'm not mistaken. Now, 3 years later, the rainy day fund is replenished, the budget is balanced. Isn't that turning out to be a success for Iowa?
At the end of the day, the only tax cuts that I'm willing to look at are ones that actually go to working families in Iowa and not disproportionately to those at the very top and corporations. And so that has always been my philosophy.
I think every time we speak, we end up talking about the search for common ground, as you've already said. And every time it seems that conversation at some point, and including now, turns to infrastructure. But we really haven't seen anything comprehensive come out of Congress in the 2 years you've been there. Do you take any responsibility for that?
We actually passed one of the best infrastructure plans ever for rural America out of the U.S. House a couple months ago. This is something that I actually had a lot to do with. Unfortunately, again, the Senate hasn't moved on it, but we are going to continue to do whatever that we can to actually get these things done. And by the way, one of the best things we can be doing when we talk about coming through this pandemic, how do you stimulate the economy? You do it through infrastructure investment. It is one of the best return on investments we have.
Former Vice President Biden is calling for a public option available to all. Of course, others like Bernie Sanders, Senator Elizabeth Warren, they want Medicare for all. Where do you stand on that healthcare reform, and what do you think realistically Congress and a president can accomplish on that in the next 4 years?
I firmly believe we need to add a public option to fix the ACA. Honestly, it should have been done in the first place. It would have dealt with a lot of the premium issues that many people felt when it wasn't added. So adding a public option so folks can buy into something like Medicare. And at the same time, you can keep your private insurance if you like it. And then also what it does is add competition into the marketplace to actually drive down those premiums.
The reason we're talking like this, of course, is because of the pandemic. I myself am still in quarantine for health reasons. While I've only been following your campaign from a distance, I think it's fair to say that I've seen you mostly adhere to the recommendations made by the CDC and other health experts when it comes to social distancing and wearing masks in public. Do you agree that all Iowans should take those CDC recommendations seriously?
100% I agree. That's why I am wearing a mask everywhere I go, because I think leading by example is important here. And that's what I've tried to do with all my campaign events. We have masks waiting at the door if we're having an event so people can put them on if they didn't bring one with them themselves. We're distanced. Even in our office, we take precautions with our staff. I work from home a lot. If anyone is remotely sick, they quarantine at home. So I take those recommendations seriously.
The governor is not following those recommendations. Weekly, we hear from the White House task force that there should be a mask mandate in Iowa. There should be more restrictions on gatherings as well. Would you support a mask mandate here in Iowa and step up enforcement to maybe help bring these numbers down?
Well, I don't support a full-blown mandate in the state of Iowa, but I do support, again, leading by example on this issue and encouraging people to wear a mask everywhere they go. Every store I'm going in has a mask requirement on their door. So I think the problem is kind of managing itself in that regard, where people are required to wear masks if they want to go into, let's say, even the grocery store.
Now, if you're elected, you're going to be taking office in Washington in 3 months. So undoubtedly, the pandemic is still going to be a key issue here in Eastern Iowa and the rest of the country. What are some of the key things that you would like to see Congress take action on immediately when you take office that are not doing now in the House or Senate?
Right. I think the number one thing that I'm talking with small businesses all over the district. I've traveled, I think I've been in 18 of the 20 counties in the last 3.5 weeks or so. I keep hearing from people, they still want to grow and expand their businesses. They have the need. They need that long-term certainty. Tax policy is incredibly important. I voted to lower taxes here in the state of Iowa. Congresswoman Finkenauer wants to raise taxes. She hasn't been shy about that. She voted against the largest tax cut in Iowa history and has said she wants to repeal the Tax Cuts and Jobs Act of 2017. So,
Planned Parenthood. You spoke years ago about turning to that agency shortly after moving to Cedar Rapids for some healthcare needs. But then you were part of a vote that stripped their funding a few years ago. Can you explain the reason for that vote when you know firsthand the services other than abortion that Planned Parenthood does provide to the community?
Yeah, I absolutely requested as much information as possible about what services Planned Parenthood was providing and what other women's health care services are available as well. I wanted to make sure that women had access to the family planning waiver program, different from the services that I access, but specifically the family planning waiver program here in the state of Iowa. I did my due diligence on that, took that vote, and as a result of that, actually, there was a report that came out last December that showed more women are receiving care now through the Iowa Family Planning Program and Medicaid than were previously receiving it through that federal program.
This is your fourth attempt to win this congressional seat. What makes you think this time enough voters are going to come around to supporting you?
Well, I think it's interesting. The only person that asked me that question are journalists and reporters. So people never ask me that question. So when I was first approached about running as a state senator, I was chairing Human Services, vice chair of Veterans. I was also on Commerce, Appropriations, and state government committees. Was very happy doing the work I was doing. Also, I was still continuing my medical practice. And my patients and activists and grassroots individuals kept asking me to run.
You served as the state's top public health official for 3 years, I believe. Right now, the top health experts at the CDC, the White House Coronavirus Task Force, they're all making recommendations that Iowa's not following. Doesn't our inability to reduce the number of cases and deaths here in Iowa show that the current strategy is causing undue pain and suffering?
Well, you're making the assumption that there's not pain and suffering by alternative methods. So the CDC also released that there were approximately, I think it was 93,000 deaths that are non-COVID deaths that are related to people not receiving care from heart attacks, from cancer, not getting cancer treatments, not getting diagnosed from cancer, strokes. So there's a sacrifice that everybody is making and everybody is suffering through.
There was talk for years of repealing and replacing the Affordable Care Act. There was an attempt to repeal it 2 or 3 years ago, and that failed, obviously, by one vote in the Senate. What exactly is the Republican plan? Because we hear about repealing most or all of the Affordable Care Act, but what is the actual plan to replace it?
Well, I think that there are various plans and various ideas that have come about, and I know that the Congresspeople, the Republican Congresspeople and the Doctors Caucus have discussed that and have a plan. But if you remember, the Affordable Care Act was supposed to not only increase the number of people that had medical insurance, but it was also supposed to bring down cost. And I think Washington Post even gave that 4 Pinocchios, and one of the greatest lies of that time was that premiums would go down by $2,500. So here we are in a system which the Affordable Care Act was supposed to solve all these problems, but we still don't have portability of medical insurance.
Do you agree that climate change is leading to some devastating effects here in Iowa, most notably that flooding? And what, if anything, can Congress do to combat this?
Well, I think Congress is already doing things to combat it when they're looking at fuel efficiency for vehicles, the support they've had for wind and solar.
Now, with the second district arguably becoming more purple than blue as it was in the past, how do you expect to hold this seat for Democrats when so far the efforts to really connect with rural Iowa are still struggling?
So that's why I'm running. It's my background that makes me a good fit for this district. And, Democrats have always championed the middle class, the working men and women of the country. And it's so important to me. My husband and I have been farming here since 1978. He too has been on the farm his entire life. His family has farmed north of us for almost 150 years. And it's so important that we are listening to the voices of rural Iowa who are saying, we can survive here and thrive, but we've got to have certain resources.
Joe Biden, the former vice president, says that he supports a plan of public option for all, not Medicare for all. Are you in support of that option? And if so, how confident are you that it would actually bring down costs for patients?
So I would never be in favor of taking away the insurance that people presently have with their private health insurance companies. But I do think we could look at a buy-in program for Medicare. I think we could look at a public health option. We should look at many different ways that we can bring down the costs of healthcare. I think it's clear that we can find bipartisan support on bringing down the cost of prescription drugs by allowing Medicare to negotiate for lower prices. And we should be really working on transparency so that people understand what their bill is, what it's going to cost before they go in to have a procedure, that there should be much more transparency around that. So again, we can drive down those costs.
Arguably, there is no relationship in Washington frostier right now than the one between Speaker Pelosi and President Trump. As the top Democrat, do you feel that the Speaker shares any responsibility for the political climate we have right now?
Well, I think that we all share responsibility for the political climate that we have right now. People are talking to me about that a lot. I get the question about, I think people are really hungry for leadership that brings us together.